Hi everybody, Dr. Debunk here doing another video on things that are important for our human health. I'm Dr. Debunk. If you haven't seen me before, I debunk medical myths, garbage, and crap spread by doctors and any other health professionals. The goal of this is that to get Americans the information they need to be optimally healthy at all decades of life, and defining optimal health as having maximum motivation, energy, endurance, and strength mentally and physically. Well, that sounds pretty good because, with age, as you get older, you will see all the things that I'm seeing at my age now where you're losing motivation, energy, endurance, and strength. And we don't want to do that. And supposedly doctors are supposed to help you do that, but we really don't because we're disease treaters. And I haven't done that video yet, but I'm going to do a big overview of what American medicine really is, because Americans don't get it. When you go to your doctor, you're seeing a licensed disease treater. You're not seeing a health professional. We don't study health. You're seeing someone who's a licensed disease treater. And there's nothing wrong with that, but most of you watching this don't have disease and you don't want to get it. And so you need the information on how to live to not get it. Well, unfortunately, to a degree, you have to protect yourself from licensed disease treaters because the other thing you could call doctors is licensed drug pushers. And that's what this video is about. It's titled, as you saw, Get Off Meds. But how do you do that when you go to a doctor's office and they want to pour them down your throat like it's some kind of soda? Well, that's because our main tool as licensed disease treaters is to use drugs. And so this is going to be about the correct use of drugs. And more importantly, do everything you can to get off them in the long run. And so let's begin. So the title, Get Off Drugs at All Costs, is critical because there's a downside to all drugs. So in the ideal world, you use drugs temporarily to bring about a change, to give you relief, to temporarily fix a system, and then you get off it because you make lifestyle changes. And sometimes that can be years, but generally it's weeks and months. And the problem is, what the dirty little secret about drugs is, they all are unnatural. There's no trees that grow drug pills. You ever seen a tree that grows medications, little tablets falling off? No. And so they're all artificial entities. You could argue that the only difference between a drug and a poison is that the drug can be metabolized away, but the poison can't. Now that's not totally true. It's an exaggeration. But so the point is, if you take blood pressure pills long enough, they're going to screw you up. They may artificially lower your blood pressure, but they're screwing up your liver and kidneys and brain for sure. Virtually all drugs are going to screw up your liver, kidney, and brains if you take them long enough. And since no drug has ever been studied over 12 years, I can find no drugs in the medical literature that have ever been studied long term. So we don't know exactly how long it takes for them to screw you up, but every single one will. I mean, if you take 10 ibuprofen a day, over-the-counter ibuprofen, 200 milligrams, take 10 a day, and you'll be jacked up in 10 years. 10 years. But every single medicine. And so since I'm a dinosaur and I've practiced for almost 40 years now, I see that it takes about 30 plus years for drugs to screw you up. If you take a drug every day, in 30 years, you won't be able to take the drug anymore. And it's getting vastly more complex because the way drugs interact, drug, and now our genes, it's a whole field, pharmacogenomics, which is the study of how your genetics should be used to determine what drugs you take, because there's all kinds of variations of how you metabolize a drug and use it. And every time you add a drug, it changes the whole parameter. It's complex. But in America, as I've already said, since we're licensed drug pushers, that's the main tool. So we don't study the reality of natural treatments, which are many, to help you with, say, high blood pressure. So let's talk about that. So let's say, as an example, examples always work the best. Let's say you have high blood pressure. You're living stressful enough life or doing all these things, inactivity, drink too much, little bits of here and there. it's complex. There's all these factors that go into why Americans at some point need high blood pressure pills, but it's a very common thing. And so your doctor goes in and you see your doctor for whatever reason, and he says, well, your blood pressure is way too high. You're 160 over 95. But wait, is that even true? Because what we're saying, without saying it, is that your blood pressure, we take it one time in the office in the worst possible way. And we're implying that, well, this means your blood pressure is high all the time like that. But that's not really true. People's blood pressure goes up 10 points minimum in doctor's office, even if you're not nervous. But look at what happens. You're sitting there 30 to 60 minutes, and you don't want to be there anyway, and he's wasting your time. And then you go in there, and immediately they stick your arm in the blood pressure machine and check it, blood pressure machine, and then check it. I got to slow down. My wife says I'm talking too fast. I need to slow down. So, and so many people, half the people have elevated readings. It's not real. And if the doctor's too busy, he's not going to come back in 10 minutes and check it again or later, especially if he doesn't have the room in his office. So you get a falsely elevated reading. You may be fine all the rest of the time. And so many times this scenario goes on, and there's all kinds of variants of this scenario. And so you really don't need the pill, but you're on it anyway. But even if the blood pressure is really high on average most of the time, and it lowers your blood pressure, it's only fixing one of 10 things that's going wrong with your body internally. And they're going wrong because of your lifestyle. And so the true fix is lifestyle, but that's complex and time consuming. And we can just artificially, fakely fix it with the pills. And then you just say, well, the pill's good for you because it's fixing your blood pressure. But it's wrecking slowly your liver, kidneys, and brain. And that's undeniable. It just takes 30 years. And the reason this became accepted, to give it a little history here, is because of the history of medicine. You know, when pills took off in the 50s, aggressively, and even more so in the 60s, most people were so healthy they weren't on any kind of medications chronically until they were 65 or older. And so by the time the pill was going to screw you up, even though it was maybe giving you a benefit of lowering blood pressure or diabetes or whatever condition you had, you were going to be dead from something else before the pill caught up to you, even though it's contributing to the something else that's killing you. And so the system just took off from there. But now I have patients 38 years old on 4 meds, or they come to me with 4 meds, and they don't stay on them because I get them off. And so everything is like this. This example of blood pressure is like everything. When you've been a healthy adult the first 30 years of your life, which is a kind of a good number, your body works. Everything is intact. And if you develop medical problems that require medications, most of the time you have to fix your life. And there's a lot of ways to fix it. There's natural supplements that lower blood pressure. There's natural minerals. I mean, magnesium is the easiest thing to do for blood pressure, but there's 3 different kinds of mags we use, and they're for different things. So if you take the common one, it's a laxative. It's not going to help with blood pressure. And there's herbs, I'm sure, that have been studied well enough, I just haven't got to that one yet, that can lower your blood pressure. But the number one thing, since we're on it, is, you know how you cure high blood pressure? Exercise. Exercise, when you understand how to do it, will fix 90+% of blood pressure problems without medication. Diabetes, that should also be treated with exercise. So, and then dietary things play a role too, depending on the decade of your life. But the point you have to see is, what I'm debunking is that medicines are a double-edged sword. And the longer you take them, the more they cut into you. And partly I'm doing this now because of something that's just happened. You know, I just made a video last week about nitrates in drugs. And I've had a little chance to study it more. And you need to look at that video because it's important if you're on any medications on a regular basis. And what's happened is, and to summarize it, nitrates aren't bad, but when nitrates, which are in everything, they're in all fruits and vegetables, they're in all kinds of substances in modern society. And we need nitrates, we use them in a positive way, but when they are mixed together with proteins with a lot of stomach acid or other artificial acids and other factors, they can become nitrosamines. And nitrosamines is a very large class of substances, hundreds of them that are different. And they're all carcinogenic. They all have been shown to have implications to make your risk factors for cancer go up. They are implicated in aggravating and causing 5 different cancers we know of, but literally, because of how they work, they are going to aggravate every kind of cancer there is. And this has been a 50-year debate and argument. Many of you are aware of it. So the goal is to reduce your nitrate consumption. The problem is all pork products have them in there because they're curing agents and blah, blah, blah. Go look at the video. But here's the point. It is a new thing that's coming out now. The dangers of nitrates in medicine. And maybe 25% of all medications have nitrates. And some have nitrosamines already in the medicine. That's crazy. The food problem is hard enough. The environmental toxin problem is hard enough. The water, hard enough. We're dealing with all these known factors that already exist. And now the concept that 25% of drugs or more have nitrates in there, it's crazy. It's urgent now more than ever for people to get off medications. If possible, if you're not broken with disease, you can get off medications. If you're broken with disease, you can take less. But you have to have health professionals that can help you understand the things you need to do in your life, changing your lifestyle, so that you can get off the medications. But if you don't, you are asking progressively to get cancer and other medical problems, just because of being on medications. And with age, people keep adding them up, 3, 4, 5. The average nursing home patient is on a minimum of 8 medications. That's crazy. That's crazy. They're essentially being pushed because of their age to get cancer. Absolutely, to get cancer. And so that's why I'm all nutty about this, and I made the other video last week because I'm just flabbergasted. The drug companies know they should not be using nitrates. They have to figure out another way to manufacture their drugs. And I haven't got that yet, but I figured out exactly what it is. It has to be with manufacturing. They need something that produces nitrates. They're using it as a nitrate donor, supplying nitrates for whatever. It's very common. And I'll figure it out, but I know there'll be alternatives. And so it's probably a cost thing. I don't know. I don't care. As I said in the video on nitrates, it's equivalent to firefighters in their 500-gallon water tank trucks adding a bunch of gasoline so that can squirt out with the water so it'll make the fire burn longer, and then they need more firefighters, so it's job security. I mean, who would do that? The firefighters would never do that. It's insanity. But apparently, the drug companies think it's okay because it's more cost effective. It's no big deal because nobody ever studied it. They have all these excuses, but I don't accept it. So you need to do self-study. As I've mentioned on other videos, I'm in the process of building a website that's going to be it's a library-based website. It's going to be like a library. And it will have, like in the case of high blood pressure, how do you naturally treat high blood pressure, which is what I've done for 29 of my 39 years, 40 years, to help people, the different natural things you can take, lifestyle modifications, and you can see measurable results. You can bring your blood pressure into the normal ranges, which are not exactly what doctors are telling you. There is a ton of people that are never going to be 135 over 85 or less. It's just not normal for them. These values are biased. I am convinced now that there's been a conscious effort to make the normal blood pressure number abnormally lower than it should be. And because what happens when you do that? More drugs. You know, I don't think 20% of Americans fall into the range of what we call normal. I don't believe it. And there's evidence to show why. Diabetes, same thing, blood pressure, blood sugars. I mean, it's so anyway, all of these are the reasons that you have to work. You have to educate yourself, find naturopaths that do websites, have websites. So, when somebody first gets told to have high blood pressure by a doctor, best thing you could do is, if you had the money, walk out and say, bye, no thanks, and go pay for a naturopath and let him show you what herbal extracts and other things they've learned and do, that could help you. And then the next stop is to go to an exercise trainer, a, degreed, somebody who's a trainer, he's an exercise physiologist, kinesiologist, somebody that has some real knowledge. Let him put you on a program tailored to lowering blood pressure with exercise. But then my estimation from my experience is that the lifestyle modifications are as good as 2 blood pressure medications. That when you get good at these modifications, it lowers your pressure as good as 2 medications. I've seen it for 20 years doing this with patients. So, but again, the information, so it'll be eventually, it's one of the first things I'll do on the website, which will hopefully be up and running in 2 to 3 weeks. So let's summarize, because it'd be endless. The correct use of medications is temporary, short-term, until you can make lifestyle changes to get off the medications. It can take a while, it can be complicated, but you have a duty to yourself to dig and get information about things that are beneficial. So in the case of high blood pressure, which is an easy one, that you get a blood pressure machine and you check it at home and you get frequent readings and you learn all you can about how to do this. And then you begin the quest of lifestyle modifications and check your pressure. And you can start to lower your medication. There's a way to do it, which is how to do it with patients progressively. Because the need has become so evident now. It's so important because of the nitrates. Is just one. I only told you about the nitrate things. There's more here of why people should get off medications. But doctors are like allergic to getting people off medications. That's a whole other thing that I don't get into, but it's just doctors aren't bad for doing this. We really think people can live longer and healthier on medications. Now, and that's partially true if you're broken with disease. That is absolutely untrue for anyone who is not broken with disease. The medications are cutting short your life and messing you up in other ways. Yes, on one hand over here, they're helping your diabetes, blood pressure, headaches, menstrual irregularities, whatever it is you have. But on the other hand, it's really hard and bad for your body in so many ways. But because it takes decades for drugs to mess you up in a bad way, and doctors just see the good benefits of immediate fixing of the abnormal physiology, we're blinded by the long-term problems. And there's so much more there. Like, I, as a doctor, am trying to manage your health situation right now and for the next few weeks or months. To think about what might happen to you in 2 years or 5 years or 10 years, it's beyond what we do, But that's my focus. Patients see me, and I don't care half the time right now what's going on with you or any suffering you may have. I just tell you, suck it up, because I want to know where you're going to be in 10 years, because you'll get there someday and you'll regret not doing what you could have done 10 years earlier to be in a much better place and on much better medicines and to be much healthier. And so that's really the big picture. I guess I'm saying medicine is broken in this regard to where we can't even entertain the concept of lowering medications. We don't. It is changing a little bit. I do hear little bits from colleagues about trying to do better at it. But we're dogs. We're doctor dogs, and we go to the feeding bowl of drugs, and we just eat. And so, anyway, this is an introduction. As I said, the website, Dr. Debunk website, will go down condition by condition with every single thing I've learned and the things that I will learn on giving you tools to reduce your medications. Short-term use of medications, I'm all for it. I mean, when you have a cold or flu, and I did that video, when people have bad flus, I'll stick you on 5 different medications to give you relief because you're not going to be on them more than 3 to 7 days and you're done. And that's not a problem because we metabolize meds. It's short-term use. I'm all for it. But the long-term use, it's danger, danger. So that's it. That's an intro to this. I'm Dr. Debunk. Thanks for watching.